Hey guys, it's Tandra. We're going to be on page 37 today, which is our minor surgical procedures. Before we get into the lesson, of course, let's go ahead and tackle our prefixes. So these are going to be specifically still on our body part prefixes, and we're going to start with the word cardi. So we know that cardi means heart. I want you to write the example, inflammation of the heart. So go ahead and write that out for me. So write inflammation of the heart. So what medical term would I write there? So inflammation of the heart is going to be carditis, because we know itis is inflammation. So I want you to do the same with a few others. So let's do cephal. Cephal is referring to the head. I want you to write inflammation of the head. So go ahead and fill that one out. Then when you get done with that one, I want you to write inflammation of a cyst, which happens to be a bladder. So I want you to write inflammation of that. Then for derm, remember you can use derm or dermat. And in this case, I want you to use the term dermat. And again, I want you to write inflammation of that. So dermat meaning skin. So I want you to write inflammation of such. Okay. Then our next one, I'm going to go back up to chole. Chole is referring to the word gall or the word bile. I'm going to use the example cholecystectomy. And I want you to write down the breakdown of that word. Then let's go ahead and do coron, which is referring to the heart or the crown of something. I'm going to use the example coronary, which is just pertaining to the heart. Then for crani is referring to the skull. And I'm going to write to cut into the skull, which would be a craniotomy. Okay, so just to make sure you have the others, so like I said, I wanted you to write inflammation of those medical terms. So for cephal, you would have wrote cephalitis. For cyst, you would have wrote cystitis. And for derm or dermat, you would write dermatitis. Okay. And then I wanted you to write out what cholecystectomy meant. So chole refers to the word gall. Cyst is referring to bladder because we just covered it just a few terms down. And then ectomy is the removal. So it's the gallbladder removal. All right, guys. So I just kind of want to start challenging you on some of those. That way, when you're at the national, you're able to break down those words easily. Okay. Let's go to our definitions. Make sure and know that if you make your note cards, we'll give you extra points. And let's look at some of those. So the first three, I'm going to kind of link them together. So we have fasting, NPO, and basal state. Let's start with NPO. NPO means absolutely nothing by mouth. And it's typically going to be anywhere from 8 to 12 hours. Now, when we say nothing by mouth, there can be one exception to NPO, and that's going to be medications. So I'm going to put that in parentheses. But if I use the term fasting, this is going to be a little bit more relaxed. This is where you're going to have, again, nothing to eat or drink for 8 to 12 hours. So no food or water for 8 to 12 hours. And the reason it's different than NPO is because NPO means absolutely nothing by mouth whatsoever. But medications, it just depends. Whereas fasting is no food or water, but they're a little bit more relaxed on that. Meaning you're allowed to take your medications with sips of water. And depending on why you're fasting, they may even allow you to have water and black coffee. It just depends on the physician as well as why you're fasting to begin with. And then we have the term basal state. So basal state is going to be your fasting and you cannot get out of bed, so you must remain in bed. So this is going to be for inpatients only. Okay. The next term we have is anesthesia. If I were to ask you what anesthesia is going to be one of those things, it's a little harder to kind of just come up with the definition, but we all kind of relate to it as you're putting the patient to sleep during surgery. If I were to look up like the long definition for anesthesia, it's basically going to be a medication that's going to kind of, I don't want to use the word paralyze, but it's going to make the patient lose the ability to, think, breathe, things like that. It's going to really control their nervous system to where they can't feel pain, but then that also means they can't breathe on their own and things like that. So I'm going to try to put a definition that's a little bit of both, so that it's easy to understand. So anesthesia is a reversible loss of sensation and consciousness. And it will also, when we say it'll allow us to have the loss of sensation, I want you to think loss of our pain receptors. Okay, but if you were to just simply say it's going to put you to sleep during surgery, I would understand that that's also anesthesia. But to give us more of a medical definition, it's the reversible loss of sensation or consciousness for surgery. Then we have the term debridement. This is where a wound of some sort, you're going to remove debris or foreign objects. So remove debris. So debris could be anything from like sand and rocks and dirt to foreign objects. Then we have the term bandage as well as a dressing. Bandage is like a band-aid. It can cover a wound, but it also sticks to the skin. So a bandage can cover a wound, but it also has an adhesive. So I'm going to put cover a wound and adhesive. Whereas a dressing does not have an adhesive. It's just simply going to cover a wound. So there's nothing that's going to be sticky about it. So no adhesive. Then the next four I'm also going to highlight. And these are going to refer to different types of fluids coming from a wound. So the first one we have is serous. Serous is a watery fluid resulting from clotted blood or a healed wound. So watery fluid resulting from clotted or healed wound. So it's a good thing. It's what we want. So I'm going to put a check mark by that one. Whereas, let's skip serosanguinous and go to sanguinous. Sanguinous is going to be active bleeding. So that's not good. Going back up to serosanguinous, it's going to be a combination of both. So it's going to end up being watery, fluid, and blood. So it kind of looks like watered down blood. And this is, we don't want that either. We do want it to completely heal. And then lastly, we have the term purulent. Purulent means there is pus, which does indicate an infection. So that is not good. We don't want that. All right, my peeps. So, as you see, this chapter is referring to minor procedures. So before we get into some of those minor procedures in detail, let's just look at a quick description of a few that are going to be done more so in a clinical setting, meaning inside of a doctor's office. The first one is going to be an IND, which is an incision and drainage. So this is where you're going to open some type of wound and drain an abscess. An abscess, as well as purulent, is going to be essentially the same thing. Both mean that there's an infection. Abscess or purulent fluid mean there is an infection. Okay, next we have the term colonoscopy and colposcopy. So both of them are going to be scopes, whereas a colonoscopy is going to be for exactly that. It's going to be inserted into the rectum and looked into the colon for polyps. So all the way through the rectum, all the way into the colon. Remember, for this one, your patient needs to be in the Sims position. Just as a little bit of a review. A colposcopy, C-O-L-P, is referring to the vagina. So a colposcopy is a vaginal exam. That patient would need to be put in the lithotomy position. See how some of this is kind of all starting to kind of all come together? At least I hope you see that. Then we have called an electrocautery. So electro, meaning there is an electrical current, or it says here high frequency current, that's used to remove tissue or coagulate vessels. It literally kind of burns it in a way. So I'm going to put that in parentheses. And I will say, anytime electrocautery is used and it does kind of burn it, it does start to smell really bad. So anytime you assist with that, you may want to use a mask. Then we have the term just biopsy. Biopsy, just that term in general, is non-specific. So if I have a patient that comes in and says, oh, I'm here for a biopsy, I would need to know what is being biopsied. So is it a lesion? Is it their liver? Like it could be very, very, very simple, or it could be something that does require a little bit more preparation. So just the term biopsy is not specific. So this is going to be where we're going to take a sample of whatever it is that we're going to biopsy, and we're going to look at it. So it's going to be used for analysis, because the term analysis just means we need to test it. We're going to look at it. So I'm going to put test / look at it and see if it's abnormal. And when I say we, I mean the physician. I should say that better. So the physician is going to take a sample, and they are going to look at it to see if it's abnormal, or test it to see if it's abnormal. Then lastly, cryosurgery. The term cry meaning freeze. And this is where they're going to take nitrogen and freeze the tissue for it to come off. So it's kind of cool. All right, so in addition to knowing those descriptions of those few procedures, we also need to look at some of our patient preparation instructions. So it's our job to go over the prep instructions, pre-op, post-op with the patient, as well as whoever it is that's going to bring them to that minor procedure if they need anesthesia. So if the patient needs anesthesia, they need someone to drive them. So someone must accompany that patient, because they're not going to be able to drive, let alone even be able to kind of understand you. So make sure that you let the patient know somebody is going to need to drive them. So like I said, it's our job to review the pre-op and post-op instructions with the patient. Each procedure has its own pre-op and post-op instructions. And what's really nice is most of the facilities that I've worked at, let's say that the patient's coming in for a colonoscopy, I would literally get the procedure sheet or instructions that have the word colonoscopy up at the top and just review them with the patient. And so it's very easy. It's like one procedure has one piece of paper that you're going to go over with your patient. We're going to let the patient know what time they should arrive. We're going to let the patient know if they need to fast, be NPO, or basal state. And then, of course, like I said earlier, we're going to review the post-op instructions with the patient, but also the person that accompanied them. And then before the patient leaves, we want to make sure and schedule them for a follow-up. That way they have the follow-up appointment in hand before they go. Okay, so on our next page, we're going to look at some of our basic surgical instruments, because these are going to be used for a wide variety of things. So the first one we have are forceps. Forceps, if we look at this pair right here, they simply look like tweezers, don't they? But in the medical field, they're called forceps. And then these are more of what are called looped forceps. And they're just going to be for larger amounts of tissue. Whereas the ones that look like tweezers, they're still forceps, but they're just going to be for smaller amounts. And regardless of which one you need, whether it's a looped or not, they're used to grasp items or tissue. Keyword is grasp, though. So for example, you're going to need forceps when you're removing sutures and for also debriding a wound, because it can pick out very small pieces of rocks, things like that. All right. Next, we have the term hemostat. Hemostat kind of looks like scissors, except this part there does not cut. It's just used to clamp. So highlight the word clamp right there. And what's really nice is this hinge here and here will keep it clamped so that we don't have to. So hemostats are used to clamp vessels, as well as an umbilical cord, but any type of vessel. And a vessel is anything that essentially holds fluid in a way. Then we have scissors. And what I want you to pay attention to are the points of the scissors. So if you look here, those are pointed. They're very sharp and pointed. Whereas the next one, you have a round and a point. It's like half and half, which is also the third one, because they can be pointed or curved. So when a physician needs a set of scissors, it's important to know if they need to be pointed. Pointed could also mean just sharp. You could use those two terms interchangeably, or if they need to be curved. And it's going to be used for cutting or dissecting. So to me, those words seem very, very, very similar, right? Cutting and dissecting. But let me tell you the difference between the two. So cutting, sorry about that. So cutting is simply going to be to remove it. So cutting is to remove. Where dissecting could be to remove, let's say, skin from tissue, or pull apart skin from tissue. So pull apart skin from tissue, or cut smaller portions. Okay. Next, we have a scalpel. So if you look here, we've got two pieces of a scalpel. I want you to label this as the blade and this as the blade holder or handle. But if we put the two together, blade plus the handle, these equal a scalpel. So that's the difference. So blade plus the handle is a scalpel. So a scalpel is going to be numbered. So blades are numbered, and the handles are interchangeable. So let's say that the physician needs a 10 blade. Well, the number 10 will be on the package. And these are going to be used to cut into tissue. So this is going to be to open the skin or cut into the skin. Then we have a speculum, which is going to hold open an area for visualization, which we all know that's going to be for the vagina. Now, we do have another scope that is used to hold open an area called an anal scope. And it looks very similar. It's just smaller, and it's going to be used for the rectum. And it will hold open the rectum for visualization. All right. Then we have the term Mayo stand, which you guys learned about that last week. So it's just going to be a table used for sterile fields. And then we have a basin, which we learned about that last week as well. It's just simply a container that is used to hold any type of fluid. It could be fluid like, saline or iodine, or it could also be bodily fluids as well. I do want us to look at the difference between the two. The one that's shaped like a kidney is a kidney basin, and the one that's just shaped like a bowl is just simply a basin. All right, guys. So let's go to our next part. So the next part is going to be how to remove a dressing as well as the bandage, and then how to apply a bandage as well as a dressing. And then it'll kind of finish up with learning how to remove staples as well as sutures. So let's go back here. I brought up a few pictures as well that I'm going to kind of go back and forth to. So like I was saying earlier, there are some things that we can do as a medical assistant that we can do independently, and this happens to be one of them. And there will be a lot more that we're able to do independently as we go through our lessons. But for example, let's say that a patient comes in and they need sutures removed. Once the doctor looks at the wound to make sure it's healed, we can go ahead and remove those sutures on our own. The doctor does not have to be kind of hovering over us, is what I mean. So let's see how we're going to remove a dressing. So dressing removal. So the first thing that we, of course, have to have is a doctor's order. So we're going to check the EMR for that. That order is going to be in the plan of our SOAP notes. And then once we complete whatever it is that we're about to do, we need to document it in our objective section. Okay, so the first thing that we're going to do is we're going to go ahead and assemble what we need as well as get any supplies that we need. So we have here, we're going to get gloves and a mask. This does not require sterile gloves, so I'm going to put non-sterile. And a mask, depending on the facility, may be optional. It just depends. A disposable drape, I would use a fenestrated drape since it has a opening, but a non-fenestrated drape would be fine too. So you could put either or. Keyword on this one, disposable, because you want to be able to throw it away. We also need bandage scissors. So bandage scissors are going to have a dull end as well as a pointy end. So we want dull bandage scissors. And then lastly, we could use sterile saline or a solution in case the dressing kind of gets stuck to the wound. We don't want to just pull, because that will pull off the scab that it's created. So anything that gets kind of stuck, we want to saturate it with saline or any other type of solution for removal. So we may need that, we may not, just depends on the patient. Okay, so it says first we're going to perform hand hygiene, of course, and apply disposable gloves. Surgical mask, like I said, may be optional. So the first thing it says is place a disposable drape under the site of the wound. So this is just going to be to protect kind of anything that may fall off of the wound or any type of liquid that may fall. So we just want to put a disposable drape under the site of the wound. So let's say that the site is on the arm. We're going to place the drape under the arm. All right. Then it says remove the bandage using a set of bandage scissors. And again, the bottom part of our bandage scissors are going to be dull so that it doesn't accidentally cut our patient. So it says, cut the bandage material to the side of both the wound and the dressing. It says, remove the bandage without removing the dressing if possible. So let's look at that here. Okay, so right here, you have this disposable drape that's under the arm, and then on top of the patient's arm, you have a dressing and a bandage. And the medical assistant right now, let's say that the bandage is covering the wound, and the wound is right where my X is. So I don't want to cut in the middle of the wound. I want to cut to the side of the wound. That way I don't come over the wound itself, okay? So again, let me get rid of my markings real quick. So I want to cut on the side of the wound there. All right, so remove the bandage using bandage scissors. Cut the bandage to the side of both the wound and the dressing. It says remove the bandage without removing the dressing if possible, because sometimes they get stuck together. So it says carefully remove the dressing by pulling the corners toward the center of the wound. So let's look at that one as well. So she went ahead and cut the bandage off, and the bandage is laying here. The dressing is here, okay? And what they're doing is they're grabbing the corners of that dressing, and they're gonna grab each corner and pull it towards the center of the wound. So they'll grab that corner, pull it up, this corner, pull it up, this corner, pull it up, and then that way it's not going to kind of pull at the wound and doesn't pull the scab off. So we're going to bring each corner up and then take it off. And don't worry, we're going to do this in class as well. All right, so it says pulling the corners towards the center of the wound. If you feel any type of resistance, you may want to irrigate the dressing with sterile saline. So we would literally soak that dressing with saline and kind of let it sit for just a few minutes, and then it should easily pull off. Once it comes completely off, we're going to inspect the inner portion of the dressing for any drainage or odor, and go ahead and make a mental note of that. That way we can document it. It says go ahead and dispose of the material into the biohazard bag, not a sharps container because it's not sharp, but in a bio bag. Then we're going to go ahead and remove our gloves and perform hand hygiene. Let the physician know they can come in, and the physician is going to go ahead and inspect the wound. All right, so now at this point, let's say that the doctor came in and said everything looks good. Go ahead and reapply a sterile dressing. So remember, sterile meaning we need a sterile field. And a sterile field, once we put on gloves, the gloves also need to be sterile. So a little bit of this is going to be like last week. So we're going to go ahead and wash our hands. We're going to position the Mayo stand 12 inches away in front of us. And remember, it needs to be at waist height. We're going to clean it with a disinfectant and allow it to air dry. Now at that point, if you want to go ahead and put down a sterile drape, that's completely up to you. It just depends on exactly what you need and if they're inside of a kit or not. Okay? All right, so it says place the supplies needed for wound care and the sterile dressing application onto the Mayo stand in the order of which you're going to use it. So the first thing we need are antiseptic swabs. These are typically going to be iodine, okay? But they need to be sterile. If they're allergic to iodine, you can use chlorhexidine. Then we need a dressing, but again, it needs to be sterile. Our bandage materials do not necessarily need to be sterile. Bandaging materials are going to be more like tape. We need bandage scissors, just like we had earlier, to remove the dressing. And then the medical tape are going to be used if our bandaging materials do not have adhesive. All right, so it says, arrange each peel pack. These are going to be our sterile pouches. Because remember, everything that's up here needs to be in a sterile pouch. Okay, so our bandage scissors, everything except for our tape need to be sterile. All right, so it says arrange each peel pack or sterile pouches so that they are facing sideways on the mayo stand. So if this is my mayo stand, and I've got 4 different pouches, let's say I've got one for my bandage scissors, I've got one for my dressing, and let's say I've got another with my antiseptic swabs. I'm gonna put them sideways like that. That way I can easily just grab each of these, okay? If they were placed like this, here, here, and here, I'm gonna have to reach over one to get to the other. So I want to lay them sideways on the mayo stand. So none of that, because I'd have to reach over it. I'd have to kind of come over and reach, come over and reach, come over and reach, and I don't want to do that. Okay. Let me just get rid of part of that. So I don't want them like this because I'd have to reach over and reach over. So I don't want to do that. Okay, so once I arrange them, it says this is going to prevent you reaching over the sterile field. I'm going to go ahead and highlight that. It says open the packs by peeling the top corner or the top layer all the way back so that the contents of my pouch are fully exposed. It says tear off a couple of pieces of the bandage tape, and we're going to put them on the side of the mayo stand. And we're just going to allow them to kind of hang off. And because they're hanging off, that's what makes them not sterile. So that's why tape does not necessarily have to be sterile. It says open and remove the first sterile swab, and we're going to now start cleaning the wound. And this is the part that we're also going to do in class. We're going to give you guys all fake wounds and we're going to clean them. So it says remove the first sterile swab from the pack. We're going to clean the wound or the incision line at the center of the wound. And we're going to go from one end to the next end. And in this little paragraph, it talks about the edge of the wound. But I'm going to show you what that looks like. So let's say that the wound is here. So what I would do is we're going to take our cleanser of whatever kind, and I'm going to roll, and it's going to look kind of like a Q-tip in a way. I'm going to roll the Q-tip straight down the middle of the wound. Then with my other swabs, I'm going to continue to go down the sides of the wound. So I'm going to go down this direction and this direction. So it's going to be middle and then top and bottom, or bottom top, as long as you do the middle first. Okay? So I'm going to put middle of the wound. then top, then bottom. Or it can be vice versa on that one, as long as you just do the sides. All right, let's go to the next part. So once we've cleaned it, we're going to go ahead and allow it to air dry. When we cleaned it, we did that with our bare hands. Because the antiseptic swabs that we're using has a handle on it, we're not actually touching the Q-tip part, so we don't need gloves because we're not coming near it. But at this point, we are going to get near the wound. So now we're going to wash our hands again, and we're going to apply sterile gloves. So it says, remove the sterile dressing from the package and place over the center of the wound. So remember, that part is the dressing because the dressing doesn't have adhesive. So it says, pick up the bandaging material and we're going to wrap it around the dressing. Then once we've wrapped the bandage around the dressing, we're going to secure it with tape if it doesn't already have it on there. We want to make sure and ensure that the bandage is not too tight. We don't want to cut off circulation. Then we're going to throw everything away, wash our hands, and then of course document the procedure. When we document the procedure, we want to include the condition of the dressing once it was removed. So if it had any of the fluids that we were talking about, like serous fluid or serosanguinous or purulent, we want to write down any type of fluid that was on the wound. Then we're going to document that the provider assessed the wound, and I just typically write notified the physician. And then we want to write down what we used to clean the wound, as well as that we dressed the wound, and any care instructions that we gave to the patient. So let's say that I am going to document on the patient's right forearm. That's where the wound was. So I would have put something along these lines, my patient's chart. I would have put removed dressing on right forearm. Okay. Let's put purulent fluid was observed. Notified doctor. Okay. And then I would put dressed the wound and cleaned with iodine. And then of course, date, time, initials. And yours doesn't have to be exactly like mine. It just has to have, each main step of what you did. And we're going to practice that in class. Okay, so now let's look at how we would do this if it was not sterile. So let's say that the doctor looked at the wound and said, go ahead and apply a bandage, doesn't need to be sterile. So this is going to be non-sterile. I want you to think of this as pretty much what you would do at home, okay? So it says non-sterile technique is used for minor wounds when sterility isn't required. So basically we're going to follow the above instructions without sterile technique. So I'm not going to highlight as much here. So wash our hands, wear gloves, prepare our supplies, of course. So this time we can use saline, soap, water, wound cleanser, pretty much whatever you have. And we take out the same materials. So bandaging materials, the dressing to cover the wound, scissors, and tape. So it says clean the wound using a blotting motion or irrigate the wound to remove debris. Because once a wound is very, very fresh and we're having to debris it, the wound isn't sterile to begin with, therefore it's not going to be sterile when we remove the debris. So that's why we don't have to use sterile technique at this moment. So clean the wound using a blotting motion, irrigate the wound to remove debris if any. Pat dry with sterile or clean gauze, and if need be, we can apply medication or a dressing as directed by the physician. The reason why we need an order to apply a dressing is because some of them include ointment. Not all of them, but some of them. And an ointment is a medication, so it may be required, may not. Then once we apply the medication and dress it if needed, then of course remove gloves, perform hand hygiene, and document the procedure. Now let's look at what we would need to remove staples or sutures. Believe it or not, we're going to do this in class as well. Obviously, we can't do it on each other, but we do have fake skin that you'll be removing our staples and our sutures from. So first says, inspect the wound. Take note of how many sutures or staples are present. We want to make sure that those sutures or staples are intact. If they're broken, we have to notify the physician. It says, and check to see if the incision line is completely closed. Now, that's something that I completely disagree with. The physician is going to look at the wound first. Therefore, it's not our job to know if the wound is completely closed or not. That's going to be up to the physician. And we can't do any of this without a doctor's order. So it's their responsibility to make sure that that line is completely closed. And we're also going to see if there's any signs of infection. If there's any problems, of course, have the provider inspect the wound before starting the procedure. But again, in a textbook world as well as real world, they will always be doing that before giving you an order to remove it. So let's go ahead and look for any signs of infection just in case, okay? So serous means it's that yellow, watery fluid. So I'm going to put yellow and watery. I don't think in the definitions that we put yellow, I think I just put watery, but it does have a tinge of yellow to it, and that's okay. Then serosanguinous is going to be watery and blood. Sanguinous, remember, is just blood, it's bleeding. Purulent is pus. So the only one that's okay is serous. Any of the others, so serosanguinous, sanguinous, or purulent, that's bad. If they have red skin, that's not good either. Red indicates possibly an infection. Hot inflamed skin, again, also could indicate an infection. The last one, dry exudate, which is just dry tissue or skin, that's okay. That's normal. So the only ones that are okay are serous and dry tissue or skin. Any of the others, we're going to notify the doctor. Let's go to the next one. It says, open the antiseptic swabs. Do not contaminate the end of the swab because that's what we're holding on to. And it says, clean the incision line. So remember, center, side, side. Okay? And we're going to make sure and use a new swab for each time. We don't want to recontaminate. Then at that point, we're going to start with the second, not the first, but the second suture or staple and remove every other one. And you're going to remove this with forceps, and you're going to need scissors as well. Okay, so for suture removal specifically, you're going to use your forceps to grasp the knot of a suture. We're going to gently pull up, and then we're going to take the scissors and cut below the knot closest to the skin, and we're going to simply pull the suture. So it says, using a smooth, continuous motion, gently pull the suture towards the wound, not allowing any suture material that was on the outside to go through the inside of the wound. Save each suture by placing it on a 4x4, which is a piece of gauze. All right, it says continue by removing every other suture and then go back to remove the remaining sutures until all of them have been removed. All right. Now let's look specifically for staples, and then we'll see what we need to do to kind of finish both of these up. So it says, beginning with the second staple, you're going to carefully advance the lower jaw of the staple remover. There is a specific device that you have to use to remove staples, and it's super cool. Super cool, super easy. It says, firmly squeeze the staple remover until the handles are completely in the fully closed position. And like I said, you'll see what that looks like in class. It says gently pull up on the staple until it comes out. Save each staple and put it on a 4x4. And then continue to remove them until finished. Now, it says for finishing steps, we're going to count the number of sutures or staples that are on our 4x4 piece of gauze. And we want to compare the number with the number disclosed in the chart. Hopefully, the number that we're put in is the same number that we took out, but we want to chart if there's any discrepancies. Make sure and dispose of our sutures or staples in a sharps waste container. So, for sutures, those are going to go in bio bag or waste, whereas staples will go into the sharps. Okay. Then we're going to document the procedure, of course, stating the number of sutures or staples that were removed, the condition of the wound, whether a dressing was applied or not, and any instructions that we gave to our patient. All right, let's finish up by looking at the fluids here. So it says for serous fluid, it says clear watery plasma. I will tell you in real life, this looks more on the yellow side of things. Not yellow where it's the next one, purulent, but it does have a very, very slight tinge of yellow. Purulent is going to be very thick, yellow, green, tan, or brown. It just looks completely different. Then serosanguinous, like I said, it's going to be red, watery, whereas sanguinous is bright red. It indicates active bleeding. All right, guys, so I know the last 2 weeks are going to be more hands-on in the program to kind of, make everything make sense, but just bear with me. We'll get there. So what I want us to do is look at what we're going to be quizzed on. So the part that you're going to be quizzed on today is going to be on page 37. So quiz over this entire page, excluding our prefixes. So quiz for all of page 37. Like I said, our prefixes are not on the quiz, but everything else on page 37 will be. And then page 38, you'll be quizzed over this page as well. You'll need to be able to identify each item or each instrument. And then when we get to this page, on page 39, I just want you to know where each of these will be documented. So let me highlight that for us in yellow. So our doctor's order will be in the plan, and where we're going to document it is going to be under objective. So make sure you know that. And then let's do this. Go ahead and move on to page 40. Know step number 2. What would be considered bad? So know this part right here. And then page 41. Make sure and know where sutures and staples go. And let's go ahead and include the different fluids here. And that will be that, okay? So pretty straightforward on this one, on what's going to be on the quiz, because I just don't feel right quizzing on things that we haven't like physically, done yet. So I do want to make sure that you understand it before we do a full quiz on it at a later date. All right, so just the yellow that I wrote. All right, guys, you guys have a wonderful weekend, and I'll see you then. Bye, guys.